I'm Dr. Samuel Sohn. Thank you for watching part 2 of the breast augmentation consultation. And right now we'll be discussing the location of the incision for placement of the implant. There are actually 4 different ways of actually placing the breast implant at the time of the operation. You can place it through the belly button, through the armpit, in the breast fold, or around the areola. And of those 4, I only do 2 types of those incisions. I actually only place the implant either through the breast fold or through the areolar complex. The location of the incision, if you take a look at the little diagram, can be visible there, again, either through the breast fold or through the nipple. Approximately 80 to 90% of my patients choose to go through the breast fold at the time of the operation, and the other 10 to 20% choose to go through the nipple. There's some pros and cons associated with each. The great thing about the breast fold incision is that it's very well hidden. The only way that anybody is going to be able to see it is if you basically lift up on your breast to show them. It gives me great visualization and control of the operation, so we're able to create a perfect pocket to help fit that implant. The great thing about the areolar incision is that it can be very easy to hide that incision in the color interface between your native areolar skin and your breast skin. So if you have a tendency towards forming thicker or a little bit more visible scars, sometimes we have a tendency to go through that areolar incision rather than the breast fold incision. Both incisions are both very good. With the areolar incision, theoretically, there's a slightly higher risk of infection, although in my practice I have not noticed personally an increased risk of infection. This is because you're going through some of the ductal tissue, the breast ducts, which also contain a little bit of bacteria, and that could potentially cause an infection. There can also be slightly higher incidences of nipple numbness after the operation. So decreased sensation and a slightly increased risk of infection are the possibilities in going through the areola instead of going through the breast fold. Regardless of which option you choose, they're both very good options for placing the breast implant, both very safe, and we can place fairly small incisions in order to place these implants. Typically with a saline implant, I'll need about a 3 centimeter incision, and with a silicone implant, the incision will be anywhere between 3 to 5 centimeters. Thank you for watching this portion of the video on the breast incision. I hope this answers some of your questions, and I hope you are able to browse through some of the additional videos to get some more information on breast augmentation. Thank you.